Welcome back guys. Now in this video, let's discuss about genital infections. Under genital infections, I will be mainly discussing about the infectious causes of vaginitis followed by pelvic inflammatory disease and genital tuberculosis. In this part 1 of the video, I will be mainly concentrating on infectious causes of vaginitis. Guys, please concentrate that we have already discussed atrophic vaginitis. What exactly I meant by atrophic vaginitis? Please remember that in the topic of menopause, we have discussed that in a postmenopausal female, because of the decreased estrogens, there is atrophy of the urogenital system, also the vaginal epithelium. So that causes atrophic vaginitis because of the decreased estrogens. See, that topic is completed in the topic of menopause. But now we are going to discuss about the conditions of vaginitis due to some infections. Having said that, let's start our topic. The first topic is bacterial vaginosis. Please concentrate guys, this is vaginosis, not vaginitis. Why I am saying it as vaginosis? Because there is no inflammation in this condition. Very important MCQ. In bacterial vaginosis, no inflammation. Now, first of all, why this bacterial vaginosis? See, the reason for the bacterial vaginosis is, we all know that in the vagina, please concentrate guys here, we all know that in vagina, there is a good bacteria residing. That good bacteria is, you all know that it is lactobacillus. This lactobacillus is producing lactic acid. And this lactic acid is maintaining the acidic environment of the vagina. We know that. Because of this lactic acid, the pH is low, that is acidic pH. Now, in the condition of bacterial vaginosis, what's happening guys? Because of some reason, might be usage of certain broad spectrum antibiotics, there is loss of this lactobacillus. Okay, because of the usage of too much amount of the drugs, this lactobacillus is killed. So whenever the lactobacillus is killed, the lactic acid production is halted. Because of no lactic acid or less lactic acid, now what happens to the pH? pH of the vagina is increasing. Now I can say the pH is moving towards the alkaline side, or the pH is now becoming more basic. Now in this basic pH, what happens? Usually if it is acidic pH, means that's good. Acidic pH is good. Why? Because that acidic pH doesn't allow the bad bacteria to grow. But pH is increasing, or I can say if pH is moving towards the basic side, now it's a chance for the bad bacteria to grow. Okay. Now in the place of good bacteria, that is lactobacillus, a bad bacteria are colonizing the vaginal environment. Now if bad bacteria is present in that place, means what it will do? It will cause lots of nonsense. So a female with this bacterial vaginosis, she is going to present with the main feature of foul smelling vaginal discharge because of the growth of this bad bacteria. Okay. So we have seen what's happening with the bacterial vaginosis. The cause for the bacterial vaginosis we have discussed. Now, in the place of good bacteria, bad bacteria is growing. The question is, who is that bad bacteria? This is the question which is asked in the recent FMG exam. So what is that? All of the following organisms can cause bacterial vaginosis, except, so who is that bad bacteria? The most common bad bacteria is Gardnerella vaginalis. Okay, this G stands for Gardnerella. Okay, Gardnerella vaginalis. See, Gardnerella vaginalis is most important organism, but it's not the single organism which is responsible for the bacterial vaginosis. Which means there are certain other organisms which can cause this condition. So who are those other organisms? There are other organisms like Mobilinca species, and I will give you the list in the upcoming slide. But as of now, Gardnerella vaginalis, Mobilinca species, bacteroids, Peptostreptococcus, ureaplasma, mycoplasma. So all these are the bad organisms. Okay. Now pathology we have seen. What's the pathology lying under this condition guys? The pathology is replacement of the good bacteria, replacement of the lactobacillus by Gardnerella. Okay, that's the pathology lying over here. Now, what's the investigation of choice? Like, how can you know that the female is suffering with this bacterial vaginosis? See, we have already discussed that she is going to present to the clinic with the chief complaint of vaginal discharge, foul smelling vaginal discharge. Now what you can do, you just collect the discharge, Okay, you just collect the discharge and you just put it on the slide and see it under the microscope. Okay, now a microbiologist who is seeing under the microscope, what he or she can see? Now in this discharge, there are these vaginal epithelial cells onto which the bacteria are adherent. So please see on my top. Now in this figure, what you can see is there is this vaginal epithelial cell over which small these pink color structures are adherent. See, these pink color structures are nothing but the bacteria, our Gardnerella vaginalis. See, what I am trying to say you is, in the discharge, what you can find is this type of vaginal epithelial cells onto which the bacteria are adherent. These cells are known as 𝐒𝐻 cells. Okay. So, 𝐒𝐻 cells are seen in which condition? 𝐒𝐻 cells are seen with the bacterial vaginosis. Okay. So, investigation of choice is saline microscopy. So what we are doing in saline microscopy, we are taking the discharge, we are collecting the discharge and we are putting it under the microscope and we are seeing, okay, what's happening in this discharge. What you can see, guys, you can see 𝐒𝐻 cells. Okay, 𝐒𝐻 cells, important MCQ. Now what about the discharge? Guys, please concentrate. Right now we are discussing the bacterial vaginosis. Here there is discharge, but it is also true in Candidiasis there is vaginal discharge. In Trichomoniasis there is this vaginal discharge. But how to differentiate the cause for this discharge? See, bacterial vaginosis presents with the discharge, Candidiasis presents with the discharge, Trichomoniasis presents with the discharge. So based on just the discharge, how can you differentiate what is the cause? This is very, very important. Okay, so this is the key feature to identify the cause for the discharge. See, if it is because of this Gardnerella or the condition is bacterial vaginosis, the discharge will have certain features and certain consistency. So what is that? The discharge will be foul smelling. Okay, the discharge will be foul smelling. And what about the color of the discharge? The color is white. Okay, milky white. They used to say milky white or grey. Okay, the discharge is going to be milky white or grey color. Okay, so grey color or milky white color discharge is seen with the bacterial vaginosis. What about the gold standard investigation? The gold standard investigation is gram staining. So you all know what does it mean by gram staining. Okay, see, you just collect the discharge, you just do the gram staining, put it under the microscope and you will know the organism. So that's the gram staining is gold standard. Following gram staining, you can also do a scoring system known as 𝐒𝐻𝐿 scoring, important MCQ. See, you no need to know what and all the criteria they are taking into the 𝐒𝐻𝐿 scoring, but the important MCQ what you have to know for the exams is a 𝐒𝐻𝐿 score greater than 7. Okay, a score greater than 7 is an indicative or highly suggestive of bacterial vaginosis. What I am trying to say, guys, with the gold standard investigation is gram staining. Followed by gram staining, you can also do a 𝐒𝐻𝐿 scoring. Now in 𝐒𝐻𝐿 scoring, if the scores are coming greater than 7, then it is highly suggestive of bacterial vaginosis is there for this female. Okay, now okay, well done. Now let's talk about the amine test or whiff test. What exactly is this amine test? A female came to you and she is having this discharge. Now you just collect the discharge. When you apply 10% potassium hydroxide. Okay, if you apply 10% potassium hydroxide to this discharge, you are going to get intense foul smelling. Okay, intense foul smelling is going to be seen. So that is known as amine test or whiff test. Now let's talk about the treatment. So how we have to treat this bacterial vaginosis? Guys, first of all, tell me, this bacterial vaginosis, is it because of some sexually transmitted condition? No, this is not related to sex. This is because of some alteration in the vaginal flora. So what about the treatment? The treatment is metronidazole. Please concentrate, guys. The treatment for this condition is metronidazole. How much we have to give? We have to give 500 milligrams of metronidazole 2 times a day for 7 days. This is the treatment for the bacterial vaginosis. As I have already said, it is not a sexually transmitted disease. There is no need there is no need to treat the partner. Okay, please concentrate guys. What you are seeing over here is the 𝐒𝐻 cells. See, this is the microscopic image. You can clearly see that these vaginal epithelial cell on which you are seeing some small dots. Those dots are nothing but the bacteria, our Gardnerella. Okay, please concentrate in this image. See the panel A or the image A, what you can see is a normal, okay, vaginal epithelial cells. Okay, you can see a normal vaginal epithelial cells, and you can also see this rod color structures. These rod color structures are nothing but the good bacteria, that is lactobacilli. This is something normal. Okay, normal vaginal secretions. This is what you can see. But please concentrate in this image. This is the vaginal epithelial cell. Okay, this is a vaginal epithelial cell onto which you are seeing lots and lots of small dots. Okay, those dots are the bacteria, or I can say here what you are seeing in this image B is a 𝐒𝐻 cell. Okay, it's a 𝐒𝐻 cell. Okay, now also note that the most common cause of vaginal discharge in reproductive age group is it because of Candidiasis, Trichomoniasis or bacterial vaginosis? The answer is bacterial vaginosis. Now we have completed the topic of bacterial vaginosis. Just let's have a recap. Please see what are the organisms responsible guys. The organisms responsible are Gardnerella vaginalis, Mobilincus species, bacteroids, Mycoplasma, Ureaplasma and Peptostreptococcus, MCQ. After that, what is the pathology? Alteration in the vaginal flora. We have completed. Guys, here very important MCQ you should know. I have said you that this condition is happening. This condition is happening in which pH? This is happening in a more alkaline pH. What does I mean by alkaline pH? It's not above 7. We all know that 7 is neutral, above 7 is alkaline and below 7 is acidic. But what I am trying to put into your mind is, see, the pH is moving towards the alkaline side, but still it is acidic. So, important MCQ is, what is the pH in bacterial vaginosis? The pH will be more than 4.5. It might be 5 or 5.5. It is moving towards the alkaline side. Okay, why I am saying this? Usually, the vaginal pH is less than 4.5. It will be 4 and it can be even up to 3.5. But that's not the condition here. It is moving towards the alkaline side. Okay, important MCQ. Why it is important? Okay, because the next topic which we are going to discuss is Candidiasis. See, in Candidiasis, there the vaginal pH is maintained. There in that condition, the pH will be less than 4.5. That's the reason why I am saying it is important. So, how can they ask you the MCQ? They will say, which vaginitis will happen in acidic environment? Which vaginitis is happening in a pH of less than 4.5? Then the answer will be Candidiasis. Important. Now, investigation of choice is saline microscopy. You can see the 𝐒𝐻 cells. What about the discharge? The discharge is foul smelling with dirty white discharge or grey discharge. What about the itching guys? MCQ. This is the MCQ. Why there is no itching? There is no itching because there is no inflammation. In the starting itself I have said there is no inflammation. It's just discharge. So in this condition there is no itching present. MCQ. So gold standard investigation is gram staining. And a score greater than 7, okay, Nugent score greater than 7 is highly suggestive of bacterial vaginosis. And whiff test or amine test, what is that? Intense foul smelling or intense fishy odor upon adding 10% potassium hydroxide to discharge. Okay, so all the important MCQs and even the image based question is completed regarding bacterial vaginosis. Now let's talk about the 𝐼𝐻𝐶𝐿S criteria. What exactly is this 𝐼𝐻𝐶𝐿S criteria? MCQ. 𝐼𝐻𝐶𝐿S criteria is a diagnostic criteria to say that the female is having bacterial vaginosis or not. What does I mean by having at least 3 of the below conditions? Having at least 3 of these below conditions can say that a female is having this bacterial vaginosis. What are they? Vaginal pH greater than 4.5. We have seen why the vaginal pH is 4.5, because lactobacilli are gone. When lactobacilli are gone, no acid. Whenever there is no acid, the pH moves towards basic side. Okay. Presence of more than 20% of the 𝐒𝐻 cells. In the discharge, if you see more than 20% of the 𝐒𝐻 cells, That's a criteria to establish the diagnosis for the bacterial vaginosis. Now, positive amine test or whiff test, adding 10% potassium hydroxide in tense fishy odor. Okay. Now, what about the discharge? She is presenting to you with a milky white, non-viscous, or sometimes it can be grey also. Okay. So, homogeneous discharge. Having at least 3 out of these 4 conditions, you can say that Amsel's criteria is met and she is having bacterial vaginosis. Now, you can see these images. See, the discharge is little frothy and it is white in color. Here also you can see the discharge is whitish in color. Now, let's continue with the topic of Candidiasis. Guys, now, what is the organism responsible for the Candidiasis? Guys, Candidiasis is because of a fungus. Okay. Now, bacterial vaginosis, in the name itself it's very clear, it's because of a bacteria. Candidiasis is because of a fungus. Which fungus? The organism responsible is Candida albicans. Okay, Candida albicans, the most common organism causing this candidiasis or vaginal candidiasis, I can say. Now, please concentrate, guys. Usually, funguses don't have that much ability to infect a normal healthy person or a normal healthy female here in this condition. Usually, funguses won't affect a healthy person. But we all know that in this current pandemic situation, because of the usage of a strong steroid drugs. What are steroids? Steroids are the immunosuppressant drugs. There is prevalent of this black fungus, that mucormycosis. Now, what we can understand, funguses are going to attack especially those persons who are immunosuppressed. So, those persons who are immunosuppressed because of whatever might be the reason, might be because of the steroid intake, might be because of certain diseases like HIV, or might be because of using of oral contraceptive pills. It doesn't matter whatever might be the reason. If a person is immunocompromised, in that person's, these funguses will take advantage and causes the infections. So, even Candidiasis is coming under that group. So, organism responsible is Candida albicans. So, what is the pathology? Especially seen in immunocompromised individuals. Okay. Immunocompromised individuals. If you ask that what are the examples of the immunocompromised individuals, the better options will be steroid. It is steroid users, HIV patients, pregnancy, and a person who is having diabetes mellitus, okay, and a female who is using OCP pills. So, what are the examples for the immunocompromised states, guys? The examples for the immunocompromised states are diabetes mellitus. We all know diabetes, immunocompromised state. Oral contraceptive pills, okay, using of these oral contraceptive pills will cause a pseudo pregnancy state, and we all know that a pseudo pregnancy state or a pregnancy state is immunocompromised state. Now, steroid usage, HIV persons and pregnancy, okay, we have completed. Now, what about the saline microscopy? See, saline microscopy is considered as a gold standard. It's the investigation of choice, not the gold standard. Saline microscopy is the investigation of choice. Now, if you do microscopic evaluation, then what you can see? You have collected the discharge. Now, if you put it under the microscope and if you see means, what you can see? You can see a fungus. What are the characteristic features of a fungus? It's a hyphae. Okay, so you can see pseudo hyphae. You can see budding of the fungus. You can see spores. Okay, so these are all the features which you can see under the microscope. So, saline microscopy will reveal the pseudo hyphae of the fungus, budding of the fungus, and even spores of the fungus. And if I am talking about the characteristics of the discharge, how the discharge of the bacterial vaginosis looks like, guys, it is a milky white. Okay, it's a frothy, milky white or greyish discharge. But here, if they want to ask a question on Candidiasis, this word they will use for sure. So, the consistency of discharge in Candidiasis is curdy white. It's just like a curd. The consistency will look like a curd. curdy white. Okay, and is there any other clinical features seen with these females? Bacterial vaginosis, only discharge. Okay, bacterial vaginosis, only discharge, and there may be sometimes this dysuria can be there, but in bacterial vaginosis, there is itching? Itching is present in bacterial vaginosis? Absolutely no, itching is not present. But here in this condition of candidiasis, there will be intense pruritus. Okay, intense itching. Okay, intense pruritus, or I can say this out of proportionate pruritus. Okay, so much itching, so much inflammation is there. So that is very important point in the question. If they say curdy white discharge, a pregnant female present to the clinic with a curdy white discharge and intense pruritus or out of proportionate pruritus, then you have to think about the candidiasis. Now, what's the gold standard investigation? The gold standard investigation is culture. Okay, so the gold standard investigation is culture, and important MCQ is where you have to culture. The culture medium used is Seborrheics and Nickerson's media. MCQ. Seborrheics and Nickerson's media are used to culture this fungus. Okay, well and good. Now, what about the vaginal pH? Guys, I have said you even in the topic of bacterial vaginosis. Bacterial vaginosis is happening in a pH of more alkaline side, or happening in a more pH or basic pH. But candidiasis is the only vaginitis which is happening in a pH of less than 4.5. Important MCQ. Okay, so it is happening in a more acidic pH. Okay, well and good. Now, what about the treatment? The treatment is azole group of drugs, which includes the fluconazole or miconazole. 150 mg single dose is enough. Now, what about the treatment for the partner? Should we have to treat the partner or not? See, usually these fungal infections, they are not STDs, but sometimes they can be because of the they can be because from the partner, or I can say sometimes they can be sexually transmitted. Okay, so it's better to treat both the woman and the partner. Usually they are not sexually transmitted diseases, but sometimes, not all the time, sometimes they can be sexually transmitted also. So it's better to treat both the woman and the partner. But for bacterial vaginosis, you can safely say there is no need to treat the partner. Now let's have a recap. What is the organism responsible? The most common organism is Candida albicans, but there are also other organisms like Candida tropicalis, Candida galbata are there, but most common organism is this Candida albicans. It is seen in the immunocompromised state like diabetes, pregnancy, steroid users, OCP users and HIV patients. On saline microscopy, what you can see, a pseudohyphae can be seen, pseudohyphae, spores can be seen and budding can be seen. What about the discharge? The discharge is curdy white discharge with intense itching is seen. Usually here the discharge is scanty in nature. Okay, not too much amount of discharge, not too much frothy discharge, but the discharge is a bit scanty. What about the gold standard investigation, guys? Gold standard investigation is Seborrheics and Nickerson's media, and this is the vaginitis which is happening in a more acidic pH, and the treatment of choice is the azole group of drugs. And you can see on my top, see there is a microscopic image for the for the Candida albicans. You can see all these hyphae. Okay, what you are seeing. Okay, see these rod-like structures are nothing but the hyphae of the Candida. After seeing candidiasis, let's move on to the other condition called as trichomoniasis, and this trichomoniasis can also cause the vaginitis. Now the question is it a sexually transmitted disease or not? The first point is it's a sexually transmitted disease. So if I am saying it's a sexually transmitted disease, you have to treat the partner also. In the trichomoniasis, treat the partner also. Now first of all, what's the organism responsible for this trichomoniasis? In the name itself, it's very clear. Trichomoniasis due to Trichomonas vaginalis. Trichomonas vaginalis. So what are the important MCQ, guys? See, this organism Trichomonas vaginalis, it is a flagellated organism. You can see in the apex you are having these 4 flagellas. Okay, even in microbiology we'll be seeing, okay, this trichomonas vaginalis, it's having these 4 flagella and also one more flagella with the undulating membrane. Okay, this and all, like, that will be coming in the microbiology. We have studied. Okay, especially for FMG exams they will be asking you. Okay, undulating membrane with a flagella is seen with the trichomonas, and we also know that trichomonas is only having the trophozoite stage. Okay, that's an MCQ. Trichomonas, it's having only trophozoite stage, only trophozoite. Okay, let me write it here, only trophozoite. Okay, though it's not a topic of gyna. Okay, only trophozoite stage. What does it mean by there is no cystic stage? Okay, there is no cystic stage, only trophozoite stage is there. Now let's talk about the pathology. It's a sexually transmitted disease. Okay, very good. Now what about the discharge? What are the characteristics of the discharge? The discharge is greenish in color. Okay, greenish, foul smelling. Greenish, foul smelling discharge. What about the discharge of bacterial vaginosis? It is milky white grayish discharge. Milky white grayish homogeneous non-viscous discharge. What about the discharge in candidiasis? It is curdy white discharge or cheese-like discharge. What about the discharge in trichomoniasis? In trichomoniasis, the discharge is greenish, foul smelling discharge. Now the vaginal examination. If you have done the vaginal examination in this female, you can see a characteristic feature, some small petechial appearance over the cervix. That's called as angry vagina or angry looking vagina, or that can also be called as, please concentrate here, colpitis. Okay, colpitis macularis. Colpitis macularis. What exactly it mean by colpitis macularis? We all know colpos means that vagina. Macularis means the small macules. See, this colpitis macularis or angry looking vagina or angry cervix is seen in which condition? That is trichomoniasis. This is also known as strawberry vagina. Okay, strawberry vagina. Now please concentrate. What about the investigation of choice? The investigation of choice is again saline microscopy here. Saline microscopy. Now what you can see in the saline microscopy, guys, it's a flagellated organism. If it's a flagellated organism, will it move or not? Yes, definitely in this discharge it is moving. So what you can see is motile flagellated organisms. Okay, so this is what you can see in the saline microscopy. Now what about the gold standard investigation? Even in the before condition, that is candidiasis, you are culturing it on Seborgson's and Nickerson's media. Here also the gold standard investigation is culture on Feinberg-Whittington media and diamond media. Okay, so you can do the culture of these organisms in the diamond media and Feinberg-Whittington media. What about the vaginal pH, guys? Here also very important MCQ. Even this trichomoniasis is happening in a more alkaline pH. Bacterial vaginosis, alkaline pH, and trichomoniasis is also happening in a more alkaline pH. Still it is acidic, but it is moving towards the alkaline side. Okay, now what I can say safely, I can say that candidiasis is the vaginitis which is happening in a pH less than 4.5. MCQ. Treatment. So what about the treatment? The treatment is a metronidazole 500 milligrams BD for 7 days. Now, should we have to treat the partner in this condition or not? Absolutely, we have to treat the partner because it's an STD, it's a sexually transmitted disease. So you should have to treat all the partners for these females. Okay, so this is important MCQ, and what you are seeing is a strawberry vagina. Let's have a recap. The organism responsible is Trichomonas vaginalis. It is a sexually transmitted disease. The discharge is frothy greenish discharge. Okay, sometimes it can be having a yellowish tinge also. The vaginal examination, you can see a strawberry vagina or angry looking vagina. Investigation of choice is saline microscopy, where you can see is a flagellated motile organisms, and gold standard investigation of choice is the culture on Feinberg-Whittington media or diamond media. The vaginal pH is more towards the alkaline side, that is 5 to 6. And treatment is with the metronidazole, and you have to treat the partner also. Okay, this is the image based question which you are seeing on my top, that is colpitis macularis, also known as angry looking vagina. Now, see, this is also image based question which they can ask you from micro aspect, okay, from microbiology point of view, but still I am giving you here. See, this is the microscopic appearance of the Trichomonas vaginalis, and you can see these all 4 flagella, okay, you can see the flagella, and you can also see one more flagella, something like that, with the undulating membrane. So we have completed the topic of infectious causes for the vaginitis. Now we have completed all the important points about the infectious causes for the vaginitis. Now in the part 2 of the video, we will be mainly discussing about the pelvic inflammatory disease as well as the genital tuberculosis. Thank you.